Imagine you're going about your day when suddenly something feels off. A sharp headache, blurry vision, or maybe your arm starts to feel numb. You brush it off, but what if I told you those could be signs of something far more dangerous? Something that, if ignored, could change your life forever? Today, we're diving into the 6 warning signs of a stroke. Signs that could mean the difference between life and death. Let's make sure you never miss them. A stroke is a medical emergency that occurs when the blood supply to part of your brain is interrupted. It can happen to anyone, at any time, and knowing the early warning signs could save your life, or someone else's. According to the CDC, nearly 800,000 people suffer a stroke each year in the US alone. So what's at stake? Understanding. The early signs of a stroke is crucial for rapid intervention and recovery. This could mean avoiding permanent brain damage or even death. So, let's walk through the 6 critical warning signs that you can't afford to miss. Yeah? Sudden numbness or weakness on one side of the body. Imagine you're going about your day, and suddenly you try to lift your arm, but it feels heavy, like it doesn't belong to you anymore. Or perhaps your leg feels stiff, and when you try to move it, nothing happens. That sensation isn't something to ignore. It's one of the most common signs that something is seriously wrong. When a stroke occurs, the brain loses blood flow, which means it can no longer send the necessary signals to different parts of your body. This leads to sudden numbness or weakness, often affecting just one side of the body. You might notice that your arm feels weak, or perhaps the entire left or right side of your body becomes unresponsive. It's not always obvious, and it can happen so quickly that you might think it's just a cramp or temporary weakness. But don't be fooled. This could be a sign of a stroke in progress. Why does this happen? The brain controls every movement in your body. When certain areas of the brain are deprived of oxygen, the body's ability to function properly is impaired. For example, if the brain's motor cortex is affected, it may cause one side of the body to feel weak or even completely numb. This can happen without any prior warning, making it crucial to recognize the symptoms immediately. If you experience this, time is of the essence. The sooner you act, the better the chances are for minimizing long-term damage. In the next section, we'll discuss another common warning sign that can often go unnoticed: trouble speaking or confusion. Stay tuned to learn more about how to spot a stroke before it's too late. Sudden confusion or trouble speaking. Have you ever been in a conversation only to suddenly lose track of what you were saying or struggle to find the right words? It's frustrating, but it happens to all of us from time to time. Now imagine experiencing that but without any reason for it. You're speaking, and suddenly your words don't come out right, or you find it hard to understand others. This is one of the most alarming signs of a stroke. When a stroke disrupts blood flow to areas of the brain responsible for language and comprehension, it can lead to sudden confusion and speech difficulties. This could mean slurring your words or being unable to form coherent sentences. It might start off with small, subtle signs like feeling off while speaking, or it could happen abruptly, leaving you completely confused. What causes this? The brain is a complex organ with specific areas that control speech, language, and understanding. When these regions are deprived of oxygen, they can't function properly. For example, damage to the left side of the brain, which controls language, can cause someone to speak in a way that's incomprehensible or even lose the ability to understand others. If you or someone else experiences this sudden confusion or difficulty speaking, it's important to seek help immediately. Recognizing this symptom early could lead to faster treatment and a better chance of recovery. In the next section, we'll explore another critical sign of a stroke: sudden vision problems. Stay with us to learn how changes in your vision could signal a serious medical emergency. 2. Sudden vision problems. Imagine walking down the street and suddenly noticing that everything looks blurry, your vision is clouded, and it feels as if something is blocking your sight. Now imagine that this happens unexpectedly, with no prior warning or reason. It's not a headache, and you haven't been staring at a screen too long. This kind of sudden vision problem can be a major warning sign of a stroke. When a stroke occurs, blood flow to parts of the brain responsible for vision can be interrupted, leading to partial or complete vision loss in one or both eyes. The effects may be sudden and severe. One minute you can see clearly, and the next, your vision is compromised. This could manifest as blurred vision, double vision, or even complete blindness in one or both eyes. If you experience this, it's crucial to take it seriously. It could be a sign that a stroke is happening right then and there. Why does this happen? The brain is responsible for processing everything we see. The part of the brain that handles vision can be affected when a stroke cuts off its blood supply. This loss of oxygen means the brain can't send the signals necessary to maintain proper vision, causing these sudden changes. If this happens to you, don't wait for the symptoms to pass. Vision problems related to a stroke need immediate attention. Next, we'll look at another often overlooked symptom of a stroke: dizziness, loss of balance, and difficulty walking. Keep watching to learn how these subtle signs can be a crucial part of identifying a stroke in its early stages. Sudden dizziness, trouble walking, or loss of balance. Have you ever stood up too quickly and felt a sudden rush of dizziness, or maybe lost your balance for a brief moment? It happens to all of us occasionally, but imagine feeling that way without any obvious cause. You might feel like the world is spinning, or you can't seem to stay steady on your feet. Now, if this happens suddenly and repeatedly, it could be a sign that something much more serious is going on: a stroke. When a stroke affects the parts of the brain responsible for balance and coordination, it can cause severe dizziness, loss of balance, or difficulty walking. You may feel unsteady, unable to walk in a straight line, or even stumble and fall. It might be as if you're drunk, but without the alcohol. This sudden instability in your body isn't something to take lightly. Why does this happen? The brain controls our balance by processing signals from our eyes, inner ear, and muscles. When a stroke impacts the brain regions involved in these processes, the body loses its ability to maintain control and stability. A person may suddenly experience difficulty walking or standing, as if their body isn't responding to commands the way it normally would. If you experience this sudden loss of balance or dizziness, especially in combination with other symptoms, like weakness or confusion, it's time to get medical help right away. The earlier you act, the better the chances of minimizing the damage. In the next section, we'll dive into another common stroke symptom: severe headaches with no known cause. Stay tuned to learn how headaches can be a major red flag when it comes to strokes. 5. Severe headache with no known cause. Imagine you're going about your day when suddenly a headache hits you like a lightning bolt. It's intense, unlike any headache you've experienced before. Sharp, unrelenting, and without any obvious cause. You haven't been stressed, you didn't eat something that could trigger it, and yet this headache feels different. This type of sudden, severe headache can be a warning sign of a stroke, and it shouldn't be ignored. When a stroke occurs, particularly a hemorrhagic stroke, which is caused by bleeding in the brain's blood vessels rupture, leading to intense pressure and pain. This sudden, severe headache might be accompanied by nausea, vomiting, or even confusion, all signs that your brain is in distress. Unlike the typical tension headache or migraine that you can usually manage with rest or medication, a stroke-related headache comes out of nowhere and is far more intense. Why does this happen? The brain doesn't have pain receptors, but the eye, blood vessels, and tissues around it do. When a blood vessel bursts during a stroke, it creates pressure, which leads to an excruciating headache. This is a red flag because it signals that the brain's delicate system is being compromised, and the consequences can be deadly if not treated immediately. If you suddenly experience a headache this severe, especially if it's out of the blue, and accompanied by other symptoms, get medical attention immediately. In the next section, we'll discuss another key stroke symptom that's often overlooked: nausea and vomiting. Stay with us to understand why these symptoms, paired with others, can signal a serious emergency. Sudden nausea and vomiting picture. You're going about your day when, out of nowhere, you feel an overwhelming wave of nausea. You might start to sweat, feel dizzy, and before you know it, you're vomiting. It's not the flu, and you haven't eaten anything bad. This sudden onset of nausea and vomiting, especially if it happens with other symptoms, can be a critical sign that something is very wrong. A stroke could be in progress. When a stroke occurs, particularly in the brainstem, which controls vital functions like breathing, heart rate, and digestion, it can disrupt normal body processes, leading to unexpected nausea and vomiting. This isn't the kind of nausea you get after a big meal. It's sudden, severe, and without any logical cause. It can feel like the world is spinning, making it difficult to focus or even function. Why does this happen? The brainstem is responsible for regulating a variety of body functions, including nausea. When a stroke affects this area, it can throw everything off, leading to a sudden, uncontrollable urge to vomit. This is your body's way of reacting to the imbalance in the brain. If you or someone you know experiences sudden nausea and vomiting along with other stroke symptoms like confusion, trouble speaking, or weakness, it's time to get help fast. These symptoms can be easy to dismiss, but they are often a sign that something more serious is at play. Now that you know about these signs, it's crucial to stay vigilant. In the next part, we'll review how you can protect yourself and loved ones by acting quickly when you notice these symptoms. Here's the thing: strokes can be silent killers, but with early detection, you can dramatically reduce the risk of severe outcomes. Imagine being able to save your own life, or the life of a loved one, simply by recognizing these 6 warning signs of a stroke. What's even more intriguing is how quickly the brain responds to quick medical intervention. If you're able to recognize these signs and call for help within the first 3 hours, you could potentially reduce brain damage and even improve your chances of a full recovery. It's all about acting fast. Remember, your health is precious, and your ability to respond in an emergency is one of the most powerful tools you have. Being informed and staying alert could change your future, or someone else's. Now that you know the 6 warning signs of a stroke, I want to leave you with this question. If you or a loved one experience any of these symptoms, would you recognize them as a stroke? Time is everything, and your awareness could be the key to saving a life. So stay vigilant, stay informed, and act quickly if you notice these signs. If this video helped you learn something new or made you think about your health in a deeper way, make sure to like, comment, and share it with your friends and family. Your support helps us create more life-saving content, and together we can raise awareness about health and well-being. Don't forget to subscribe for more insightful tips and hit that notification bell to never miss a new video.